The International Early Lung Cancer Action Program, ILCAP, is a collaborative group of experts who are studying early lung cancer detection through CT imaging. We spoke to Dr. Elber Camacho, the medical director of the Desert Comprehensive Cancer Center at Desert Regional Medical Center in Palm Springs. He tells us what is being done to help diagnose lung cancer at an early stage.
Over the years, scientists have tried many different approaches to diagnose cancer at an early stage. Chest x-rays, sputum cytologies, many other interventions were tried. It was only until the study, the LCAP, using spiral CT, which is a low-dose CT scan that exposes the patients to a very small amount of radiation. By performing the study in patients who have smoked and repeating that study on a yearly basis, the cancer was able to be diagnosed in an early stage. And more importantly, it showed that the patients who were diagnosed at that early stage had improved survival compared to those patients who did not undergo that screening procedure.
Dr. Camacho tells us about patients who are symptomatic.
By the time the patients become symptomatic, they already have developed either advanced local disease in the lung, stage 3, or metastatic disease to other organs, stage 4. If you are symptomatic, if you have a chronic cough, if you have chronic sputum production, if you feel short of breath, if you have cough blood, you need to see your physician and immediately get a standard chest x-ray and a standard CT scan. Once you develop symptoms, you are not a candidate for screening. Screening means that you are totally asymptomatic. You're feeling completely well, but you have a history of smoking, and specifically you smoke more than 10 years. If you fit that criteria, then now that we have the information that this study can save lives and improve survival, it has been approved for your insurance, most insurances, to pay for this. Once you undergo the CT scan, it is very important that you see an expert, and especially a pulmonary expert, because smokers can have tiny lesions that are most of the time not cancer.
Dr. Camacho tells us a patient's story.
This was a gentleman, 67 years of age, had smoked for 25 years, 1 to 2 packs a day, had quit smoking 10 years before, and came to our screening program, had the CT scan done, the spiral CT. This patient had a very small area, 1 centimeter, less than about half an inch. This was of some concern, but not large enough to induce the start of a biopsy. So the recommendation of the team was that this should be repeated in 3 months. In 3 months, the CT was repeated, and now it was maybe about 50% larger, still not very large. We presented the case back to the conference, and the recommendation of the conference is now it was so suspicious that we recommended bypassing a biopsy, and since the patient has a history of smoking, it should be resected immediately. The lesion was removed, only had a small part of the lung removed, and indeed it was an adenocarcinoma, very early stage, and we could, after the patient came back to my office, I could reassure him this stage 1 disease, you most likely will be fine, you don't need chemotherapy, you don't need radiation. So this is the kind of case we would like to have.